I recognize the gentleman from Georgia, Mr. Carter, 5 minutes for questions, please.
Thank you, Mr. Chairman, and thank all of you for being here. All of you represent areas that are extremely important in the healthcare system, and I can't tell you how much I appreciate that. As a practicing pharmacist for over 30 years, I've interacted with just about every one of you, and I want you to know that it is a team approach, and all of you played an important role in that, so thank you for what you do. I want to start with you, Ms. Greeley, if I could. As the president of the Healthcare Leadership Council, you've made it clear that that you feel like we should be moving more towards a patient-centered Medicare system as without the independent advisory payment board. What I know that IPAB was set up to save money, and that the main way that they were going to be doing that was through cutting physicians' fees. What do you think that would have done to Medicare? What do you think that will do to Medicare if we don't pass the legislation doing away with it?
I think the number one effect will be to reduce access to care for Medicare beneficiaries. There are certain protections in this legislation that says you can't cut the benefit package for Medicare beneficiaries, you can't change their copays and deductibles, you can't change their eligibility. But what it fails to recognize is cutting payments to providers will limit access to those providers for Medicare beneficiaries. So there's a very direct effect.
Absolutely. Thank you very much for that. I want to move now to Ms. Prigliano. Was that pretty good? I hope it was.
Close as anybody ever gets.
Is that right? Good. Thank you. Thank you. I found I'll be quite honest with you. I was not prepared to ask you questions when I first came in here, but I was here when you gave your opening remarks, and I found it to be very relevant, particularly with community pharmacists, because I know the role that community pharmacists play with consultation for all areas, but particularly for diabetics, and that's where it's so important. And I was very interested in what you had to say about the required mail order and how that had actually resulted in something that we didn't, that we try to push onto someone, but what happens is that they end up going back to their community pharmacist. And why is that? Why do you think that is? I mean, just...
So while the National Mail Order Program is fantastic in the sense that for individuals who are homebound or have difficulties getting to their pharmacy, or their pharmacy is very far away, this is a great program. However, a lot of patients do need that extra support from a pharmacist. They're part of their healthcare team. And so the other issue is that the majority of individuals, if they're given a meter that is not accurate, they will go to the pharmacist and say, can you tell me why this doesn't seem right? Because my blood sugars before were this, and now all of a sudden they're this. So we're finding individuals going back to their pharmacy and talking with their pharmacist because these meters that we have now shown through the study through the Diabetes Technology Society are not accurate. And so this does impact. So it is important. National mail order is great for individuals who can use it, but we do need to have the ability to have the meters that are accurate and the ones that they're comfortable working with.
Great. Thank you for that, and I appreciate that. You know, Mr. DeYoung, I was a consulting pharmacist in a long-term care setting for many years, and one of the primary reasons that people were admitted to the nursing homes, if not the primary reason, was medication administration. And having someone who could make sure that those patients were taking their medications. Just wanted to get your input on how important a role that is in the home setting.
Yeah, there's kind of a perfect storm in the really frail elders where they're more vulnerable and they take a lot more medications. So you need constant vigilance, and the kind of home-based primary care approach where you have NPs and docs and nurses, and we have pharmacists actually at our weekly team meetings who are reviewing the med list with us. So on a weekly, if not daily basis, you need to be carefully monitoring the meds, their side effects, and their toxicities, and that prevents ER visits and unnecessary hospitalization.
So in the end, it saves money.
I mean, I think the data both...
And keeps them from going into the nursing home many times.
You know, no one wants to, not many people I talk to want to end up in a nursing home.
Sure.
And so if they can avoid the trip to the ER and the hospital, that's often the next step to the nursing home.
Well,
It helps prevent that.
running the risk of being accused of being self-serving. I mention all this because it is important, because it is a team approach. And certainly all of you, as I said earlier, play an important role in that. Certainly pharmacists play an important role in that. And I want to have a plug-in for my colleague, Representative Guthrie, who has a bill, H.R. 592, for Pharmacy and Medically Underserved Areas Enhancement Act. I hope that we will look at that, Mr. Chairman, because that is a very important bill. Yes, it will cost some money initially, but right here you see where it will save us a tremendous amount of money. Not only will it save money, but it will also increase the level of care that patients are getting, and that's the most important thing it does. And I yield back.
Gentleman yields back, Chair. Thanks.